to our show today. My name's Linda, and I'm your host this morning. And today we're going to dive into a topic that impacts every one of us, and that's public health. What exactly is public health? Why does it matter? And how has it changed, especially our lives, especially since COVID-19? I'm joined today by Dr. Priscilla Barnes with the IU School of Public Health. And Dr. Barnes is an expert in public health, and she's a founding director of the CTSI program, which she will share a little bit. But I'll start by having Dr. Barnes share a little bit about herself.
Oh my, well, thank you, Linda, for having me here today. Most importantly, I'm just looking forward to talking to my good friend and also telling more people about what public health is and how they can get more involved in public health in their own backyard. But a little bit about me, I will try not to give my whole life history, Linda, but for me, public health started with two cool people by the name of John and Lottie, mom and dad. Yeah. And so I'm a deacon's kid, military kid, raised by two wonderful parents from the South. And I feel public health came from them. And so I wanted to be a medical doctor, Linda.
Oh, my.
Yeah, I know, right? Thank the Lord that the Lord had another way. But I have to say the passion of communities came from my parents, given the fact you're a military kid, being a church kid, it's communities. And that's where I always like to tell folks, mom and dad got me my start in public health. I then came to IU and studied biology, thinking I was going to be a medical doctor. Long story short, another path was open for me where I learned there's different ways you can help people. And it's by helping people understand how they could take care of the health of their community. So I have a master's of public health. And then I decided I wanted just to figure out the different ways you could use public health in the field. So I've worked everywhere from the basements of churches, the U.S. government, also worked with nonprofits, just helping people figure out how they can help people. And that's how I see public health. Then, Linda, I got bored. Can you believe I thought I needed a PhD? So after about 5-6 years in the field, I said, well, let me figure out if there's a science to how you bring people together in a more organized way. And there has to be a science for that. So I got my PhD from Western Michigan University. So I went from being a Hoosier to a Bronco.
Oh, my.
I know. Public health is everybody, too. So I spent some time at Western Michigan University studying interdisciplinary community sciences or health sciences. And that's where I really love the concept of partnerships. It takes everyone to care about public health more than people that just go to school for it. And so I learned a lot about what that could look like when you have community and academics coming together. And Linda, can you believe I came back to IU, but not as a student, as a faculty member. So I've been at the School of Public Health Bloomington for the past 15 years.
I believe I met you in 2010 when you first came back,
yes,
and I started working with the School of Public Health before it was the School of Public Health.
That's right. It was like Hyper or something.
Hyper, yeah. But that goes down memory lane. I love that. I love how your enthusiasm for public health and working with communities. And if someone's ever had a flu shot or I've seen a poster about hand washing, they've experienced public health.
That's right.
And you want to share more?
Yeah. What is public health?
What is public health?
Well, to me, public health is just keeping communities healthy. It's more than just going to a doctor. Oftentimes when people think of health, they think of physical health. Oh, I'm sick. The cool thing about public health, it's more than just you being sick. It's more than just the individual. It's everybody. And so when we think about sidewalks, when we think about seat belts, like you said, immunization, that is public health. Mm-hmm. It's like, how can more than one person be healthy, thrive in a community all at the same time? I also had a fun time asking my family, what do they think public health is? Because I think that's the other cool thing about it. We don't have to go by one definition of what it means, but it's what it means for you personally and also in the communities and where you live, work, play, and pray. And so, like you and I have said, public health is everywhere. It's in everything. It's complex. Sometimes you can see it. I think the best example of where we saw it was COVID-19. So there were things going on behind the scenes, like how do we get ready for a pandemic? So there are people that do the planning of different emergency response plans, making sure that we have enough supplies to make sure as many people are able to benefit from getting immunizations. But then it's the actual delivery of those shots, those showing up for us, making sure people have access to food, clothing when it's not available. That's also public health.
So when you're around the School of Public Health, you'll hear the term the 10 essential services of public health. What is that when you hear reference to the 10 essential services?
That's a good question. So public health, people have different checklists. So for me, being a person that work with different populations, both academics and people in community settings, to me, it's like a checklist. Like, how are we staying organized together? Now, without that checklist, you'll have a bunch of people all over the place. And so with the 10 essential services, I'm gonna give some examples. The best way to see it is you have folks that are out there assessing the scene. Like, what does it look like? What are some of the concerns? What are some of the strengths that communities have? So there's this big category of assessment. There's another category of what we call policies, and whether it's ones that we have to create to keep the people healthy or the policies we have to implement to keep the people healthy. And then the third part is called assurance. How do we make sure we're delivering this in an efficient manner? So those are the three categories. Now the 10, if you think about assessment, think of this as who's out there collecting, analyzing the data to understand what's going on. So for an example, let's just say in Bedford, there's a big concern about teen pregnancy. Well, we just don't want to start doing stuff without understanding what's going on. So you have some folks in public health, like our local health department, they may be the persons on the ground collecting data. And then once they get the data, they'll be responsible for putting it together so we know how severe the problem is. But then also it's not about problems, it's also about what are the cool things about community that we do well. Then once we have it, how are we going to respond? So that's also another part of assessing. So once you have the data, how are we going to come together to collectively figure out what we're going to do? And then the third part is communicating effectively to plan. So we don't have everybody running around losing their mind. The next part is, which is my favorite part, how do we get the best of us together? So policy development starts in partnerships. So we all have skills, talents, abilities to bring people together so we can figure out how to respond effectively to the problem. So the other part of the 10 essential services is how we build relationships to get everybody to focus on the same goal. How do we use science, evidence-based approaches to make sure we're not just using our opinions, but that we go off of what we know and infuse that in how we can be effective in responding to things. And then enforcing the law and regulations and make sure that we're doing things in a sound manner. So that's the other part of the essential services. The last part is the assurance part. How do we make sure everybody has the opportunity to thrive and also be successful in getting the services they need? So that's, I think, the more visible part of public health when you start thinking of school clinics or hospitals, federally qualified health centers, the places I go to get the service. And then within those various spaces, we have people evaluating to make sure it's working. And if it's not, then we adjust, we pivot, and we try to figure out what works best for the community. Checklist.
Very good. I want to give a shout out to two of your colleagues, Dr. Catherine Sherwood-Laughlin, Dr. Allison Green.
Yes.
They both are working in the community on the teen pregnancy. You mentioned teen pregnancy.
I did, yeah.
We just had a community meeting with about 60 community members, or 30 community members come together to work on addressing teen pregnancy in Lawrence County, which is an ongoing issue. But changing subject, you also mentioned a moment or so ago about COVID-19 and how it has changed. Can you share how COVID-19 has changed public health and people's perception of public health?
Yeah.
And maybe its long-range impact on our communities?
Absolutely. I think COVID-19, there's some personal stories as far as the impact, but definitely when we look at it from a public health standpoint, the biggest thing I think it's done is bring more visibility on what public health is. And one aspect of public health is this fun word that many people love, epidemiology.
That's a big word.
Big word. Some people like to call it epi for short. But I would say that was the science behind the scenes. And it is kind of hard to figure out what is epidemiology and how does that show up in my everyday life. So imagine just like you have a doctor that you go to that tells you, hey, your blood pressure's okay, your blood sugar's okay. I like to think of epidemiologists as the population scientists. So when we were looking at some of the statistics for Lawrence County, thank goodness for epidemiologists, because they're going to give us an idea of the prevalence, like how much we have of something, and new cases of like teen pregnancy or heart disease or diabetes. There's people behind the scenes not looking at it just on an individual level, but when you think of the population of Lawrence County, they're looking at it from that level. And so I think one thing COVID-19 has really helped is bring more awareness about this really cool community science that we're seeing a lot of people from our younger generation being more interested in. The other thing I would say is COVID just shows that we all have something that we could bring to the table. It takes more than a hospital to take care of people. I feel that there were churches, schools, grandmamas, granddaddies rising up to help. And I think the number one thing that it shows that health is more than the physical condition that we show, that it's also spiritual, it's also mental. And so one thing I think I was personally able to witness as an individual and also as a professional is just seeing more nonprofits, more people that didn't think they were instrumental to public health, caring about people, and whether it was clothing, food, just having additional hands on deck. I think that's where I started seeing more people realizing we are public health too. So it's more than just a hospital, it's all of us. So those are the two big things that I saw from COVID. And I hope we continue with that. I hope it's not just, oh, we had this big thing happen in the world and now it's over. But I hope we take the best of us moving forward as we continue to work with our communities. Yeah.
Very good.
Yeah.
You're based at the IU School of Public Health at Bloomington.
I am.
What's the school's role in the bigger picture? Tell us a little bit about the School of Public Health at Bloomington.
Okay, well, I'm going to give you two responses to that.
Okay.
When I'm supposed to say, and then in the other words, like the bottom line. So the cool thing about our community, we have several universities and colleges. Yes, they're there to help train the next generation, but universities are also there to help us take a comprehensive look as to how we want the health of communities to look like. So we do believe that through research, teaching, and we're hoping to also be good community servants ourselves, that we take a holistic approach to how we prevent diseases, how we help teach the next generation, and how we help communities be well. And so the emphasis of the School of Public Health is to have like a very robust, reproducible, transparent research lens that we put into practice. In other words, I like to say we do more than just teaching. We like to try to involve community in all the things we do, and also try to make sure that we put our best foot forward with the resources we offer at the School of Public Health to help advance community health.
I'd like to share that Lawrence County has had a long-standing relationship with the School of Public Health from the beginning, because the School of Public Health was actually created in 2012. However, in 2010, the school, which was previously Hyper,
And hyper meaning health, physical education, recreation, you know how we love.
yeah. But in 2010, I introduced Judge Robbins to the dean of the School of Public Health at that time, and Judge Robbins shared about all the domestic murders and violence that we were having in Lawrence County. And the dean, after he left the meeting, contacted the Centers for Disease Control and said, I think we have a rural community that's in crisis. Can you come visit?
Yeah.
And in the fall of 2010, the Centers for Disease Control sent a team to do an EPI-8 investigation into Lawrence County. They were here for 2 weeks. They interviewed lots of people, faith members, school, community, sheriff, law enforcement, and counselors, and they issued a 66-page report that was sort of a guide for us to address the domestic violence in Lawrence County. But that was quite an experience, and that study would never have been done without the School of Public Health being instrumental in making that happen.
Oh man, that's amazing.
It is amazing.
So, and I think it's the best example of community academic partnerships. Notice that the community activated all of that. Can I brag about you? You were the leader of all that.
Well,
I mean, we leaned a lot on you to make sure that we were being responsive to what was best for this community, not what we thought was best. And I know Catherine Sherwood Laughlin played a huge role in that. Yeah.
But community leaders, Judge Robbins played a huge role in advocating for the community and recognizing that we had a problem that needed to be addressed, and we couldn't do it by ourselves, so we needed to lean on the university to help us try to address the problem. We still have a domestic violence problem in Lawrence County, but our domestic murders are down, and I attribute that to the hard work that took place the last 15 years in addressing that problem.
And I'm so glad you brought up this example, because most people, when they think about public health, it's easy to think about heart disease, cancer, diabetes, those physical conditions that impact a population's health. But very rarely do people see domestic violence as a public health issue. It impacts everybody. Yeah. And you have played a big role in opening our eyes up to how we could get more resources to support not only this community, but to give us some great models.
And let me say that those resources from the university included graduate students who came down and worked on developing a bullying prevention pilot for at Stalker Elementary. We also had a graduate student who worked closely with Judge Robbins to develop what is now the Domestic Violence Problem-Solving Court, which was the first one in the state of Indiana. And a shout out to Terry Lee, the grad student who put all the research behind that and made that happen.
That's wonderful. And I don't know if you remember this, but I also worked with you in my evaluation class.
Yes.
Yeah. So I was teaching a class at the time where I said, Linda, come help me. I need to teach evaluation, one of those behind the scenes, boring public health analytics, but so important to make sure we do this right. And I believe you put us in touch with the judge. And I had a group of students that were working with the judge to address some type of component of this domestic violence issue that you all encountered.
Yes.
Yeah.
I actually think they worked on the evaluation plan for a grant that was going in. So,
okay.
And we did get the funding.
You
So-
did get, hey,
Yes,
public
yeah.
health. Yeah. That's great, Linda. Now, we should share another way that you and I inspire the next generation of public health scholars. When I also asked you when I was teaching assessment and this was assessment and program planning. And I wanted to teach community health needs assessment, going back to how public health, if hospitals have electronic medical records, we have community health needs assessments. And so you were one of my teachers where I put Lawrence County as a partner community. And we worked together to try to open up our graduate students' minds beyond Bloomington, because we're based in Bloomington, but I don't think many of the students know there's more than Bloomington that make up our community.
Especially the out-of-state students
Correct.
who come to IU Bloomington, they think Bloomington is Indiana, and that's not Indiana
That's
at all.
correct. Yeah, and that's the magic of Indiana is we have 92 amazing counties. And I believe that you're going to have them on the podcast, local health departments, at least the Lawrence County Health Department.
Yes, we have the local health department, and the lead in that podcast is an IU School Public Health grad.
Yes.
And then we also will be featuring a podcast with Dr. John Kiesler with the School of Social Work, talking about a pilot project, rural mental health project for kids in Mitchell. So yes, we utilize the university as much as we can.
I love it. And so when you and I teamed up for this class, one of the things, you know how I am, I just make things up to try to get students out the classroom. For me, the best classroom is the community. I think you're very limited to when you stay within the four walls of an institution. So one thing that I love that you and I did was we got at least 20 students out of the classroom and we created this windshield tour experience. So we worked with Motor Pool at IU. And then Jane Rogan, our friend from the Center for Rural Engagement, she wanted to drive this bus because she got her bus license.
Yeah.
So it was the three of us. I still have that picture, by the way.
Oh, my.
I know. We all, I guess, had some students assigned to us. You had some students in your Suburban. I had some in mine. And then Jane had the rest on the bus. And the coolest thing I think we did that day was bring them here to Lawrence County and show them pieces of Lawrence County, Olytic, Bedford. You had us everywhere.
We were all over the place.
Yeah,
and,
yeah.
And then we left and went to Orange County, and then going to Montgomery, and gave them a real tour of southern Indiana.
Yeah. And to me, that's public health, where we bring everybody together to learn, because we're our best teachers. I could not teach the public health of Lawrence County. That's why you were a part of it. Jane was part of it because she was part of the Center for Rural Engagement, and they had this initiative that I think you all started, Sustaining Hoosier Communities.
We were the first community.
Yes, come on now, Lawrence County. So it just shows that, yeah, you can have a degree to teach public health, but we all have something to offer and contribute one another so we could better understand what's best for the communities that people live in. It's one thing for me to come in and tell people what to do, but that's not, I think it's not very impactful if you have a boring academic coming in saying this is how you should do something. It makes it more magical and come to life when I'm teamed up with someone from the community by the community is how I like to see it. So that was one of my favorite days, believe it or not.
And one of the things I like about the school public health, the partnership with community, it's a true partnership. It's not the university coming in and saying, this is your university and this is how your community should do it. It's truly a give and take.
That's right. I have a question for you.
Just one?
Well, several, but I'll start with one. When you think of just where Lawrence County was when you all were focused on the domestic violence issue, and where you are today, do you feel that the same issues are still concerning, or have you seen a shift in maybe the main public health concerns of Lawrence County?
With domestic violence, we've seen a decrease in the murder rate. Before the CDC had come, I feel we had like 17 murders or domestic murders or suicides in a very short span. We've had a few since the study, but nothing of that scale in such a short time.
Yeah.
Another topic that Lawrence County has struggled with is in the area of teen pregnancy. We still are in one of the top counties, but we had to, because of COVID, had to suspend our Teen Pregnancy Coalition. We had just got started and ramping up with Dr. Sherwood Laughlin and Dr. Green, and COVID hit, and so our coalition fell apart because we couldn't meet for a year and a half. And so we're now starting that back up and trying to address that issue. Purdue's been here, I hate to use that word, but Purdue's been in Lawrence County in partnership to try to address the issue of obesity. And that's for our adolescents. I know Jackson and Lawrence County had the highest juvenile obesity rates in the state. So so there's lots of efforts going on now. Some of that you won't know till years down the road if we've made an impact or not.
Yeah, which is why the data part of public health is so important. Like getting a true baseline, going back to those 10 essential services, the checklist.
Yes.
It's so easy to jump in and start doing the work. But I think one of the most impactful things you could do is assessing before you start doing too much of the work, what's going on? What are we trying to impact? What are we trying to change? So that way, all these partnerships you're talking about, you can see the change over time. And if you did have an impact, which I'm sure with the data that we have in partnership with you all, I'm sure we've made some impacts here. Yeah, absolutely.
Very good.
Yeah.
Very good.
Yeah.
You're also the lead with CEDIR. Can you tell us what CEDIR is and
Oh,
what
my goodness.
what the goal or what's important about CEDIR?
Well, we're not talking about the cedar tree. Okay, so yeah, CEDIR is an acronym. CEDIR stands for the Center for Community Engaged Dissemination and Implementation Research. It's a mouthful, I know. But just think of, in the School of Public Health, we have many different resources. And one of those resources, we have centers that really want to focus on people, public health, and practice, and research. So think of CEDIR as another resource to communities where we work directly with communities to figure out research and put it into action. One thing that researchers love, they love to think, they love to set up research studies. Oftentimes that's led by the researchers. With CEDIR, what we pride ourselves in wanting to do is have community experts like yourself, folks that Catherine and Allison work with, like bring more community voices to the table, and we co-create, co-implement those things together, as opposed to have researchers coming into your own backyard and telling you how you should do public health. No, we want all that expertise at the table, and that's how I see CEDIR. Yeah. What I'm most excited about is oftentimes when you think about centers at a university, they're there for the faculty, the academic doing research. I think it's been just a rarity for us to think of a center that involves both community and academic partners working in the same space. So that's been really exciting, is to be part of this on the ground up development of a center that's different from how most academic institutions think about centers. It's not about just grabbing money. It's not about just academics doing their research. It's more about, let's create and cultivate spaces where we could show up, both community and academics together, creating things that are relevant for what communities are going through. Most academics, we sit in our offices or we're inspired by what we spent years studying. But I think it's a really cool challenge when you can, hey, Linda, come on, I got this idea. Let's come together and kind of think about how this would be meaningful for Lawrence County. And that is really rare. So I like to think of CEDIR as community voices are invited, heard, and honored, just like academics have the degrees. But what I'm hoping is to create a space where we feel like we're equal partners. So I'm really excited about that. And so with Stonegate, yay, Stonegate, you're one of our premier partners in this, and I can't thank you enough. But I'm just curious, from your lens, when you think about this space where we could co-create together, how can we make sure it's relevant for the people here in Lawrence County?
Well, not just Lawrence County, but the region. One of the benefits of Stonegate is that we're developing co-work space and remote and being a facility where remote workers can have a place to land and work. And with CEDIR, the collaboration with CEDIR will allow faculty members to maybe use Stonegate as a remote work site and be actually in the community and off that campus.
I love it.
And they can work out of Stonegate and meet community members either at their location or invite those community members to Stonegate for meetings. And that's a lot easier for rural community folks to come to Stonegate versus going to IU and battling parking and just the stress of getting around. And so it's a win-win for everybody.
I love it. And also, when you're in somebody else's space, it doesn't feel comfortable. And that's oftentimes the number one thing I hear from community partners. It's like, even when I'm on calls, they'll say, well, I don't know what you all know. Thank goodness for that. We don't want you to try to feel like you have to be someone different. We want you to be yourself. And the fact that you all are offering space so people can be themselves, and then we make the academics feel a little bit uncomfortable, that excites me. But then most importantly, we get them away beyond the sample gate so they can really embrace what the communities look like, who's in these spaces, and how we can work together. So I love the fact that you're working with us to think of ways that we can have these shared spaces together.
We appreciate the opportunity to partner with the school and public health, and we also offer space to school social work. So, yeah.
Well, another thing that you've done, I just want to keep bragging about you, Linda, because you're so awesome. But the strategic doing. Okay, so that's another thing that CEDIR is hoping to do more of in regional spaces. What I love about strategic doing is it's focused on the assets, the gifts, the talents, abilities we as individuals bring to the table, and it's different from strategic planning. Now, I hate strategic planning. Can I be honest? The reason why is typically I'm told to come to this meeting for half a day. I got to kind of sit in the space and imagine what may work, what will work. And it's almost this forced effort of thinking of all these things that you don't know if they're going to work or not. Versus strategic doing, I like how you say it. You don't have to do it forever. It's within these short incremental processes that we put into place within 90 days. And so we've had here, thanks to you, a strategic doing workshop where we've worked with both Lawrence County and Orange County to think about what the partnership with CEDIR, those academic partners coming into various community spaces, if it was domestic violence, teen pregnancy, literacy, which I think came up in our conversations.
Yes.
What would that look like in 90 days if we were to put our best resources and ourselves forward? What would we create in 90 days? And it was kind of cool to see what came out of that. I think for me, I think the health department was involved in one group where they just listed a number of volunteer opportunities we can invite students to. I know I'm working with Kathy. She's very passionate about literacy. What would it look like if we incorporated something related to health literacy? Because you have literacy in general, but reading a food label, how do I do that? Like, how can we come together with these health resources and incorporate it in her program? But I know those were two big things that came out of that session. So again, Stonegate played a huge role in allowing us to have the space to kind of do something different. Yeah. So, but yeah, I look forward to just continuing to kind of co-create ideas and work with different people in this community to figure out what is relevant for their needs.
This has been a great conversation, very enlightening, a nice snapshot of what public health is.
You all don't take anything away, and I did ask my family, how would you wrap up what I've said today all in one word or a phrase? The best way I could, again, just tell our wonderful community here, what is public health? Just know it's everywhere, and even when you don't notice it, it's there. And think of it as the quiet superhero in your everyday life. It shows up where you expect it or not. And so I hope that's the key takeaway that we take away today from our conversation.
Very good. For our viewers, if you want to learn more about the School of Public Health at Bloomington or CEDIR, check out the link in our show notes. Until next time, stay safe and stay connected and stay informed. We appreciate Dr. Barnes being here today, and we appreciate celebrating Public Health Week. I guess we didn't mention it, April's Public Health Month, so thank you very much.
Thank you, Linda.